Hello everybody, it's Mr. Green, and I'm going to be doing my breathing for singing demonstration. I've got my lung that I got from the dollar store, and I hope everyone remembers the sciencey word for this part right here. It's your trachea, or your windpipe. And this part down here, of course, is the lung part. Now for a second, I want to talk about the diaphragm. The diaphragm is very important for singing because your lungs aren't muscles, but you do need to use a muscle when you breathe. And that muscle is your diaphragm. Your diaphragm sits right below your lungs. Drop my lung. It's right below your lungs, and it's right about here. It separates your chest from your abdomen. So for this demonstration, my hand is going to be the diaphragm muscle. And here's my lung. It's going to be right above my diaphragm. And now I'm going to try and fill my lung with air. I didn't get very far. So let me try again. And this time, I am going to allow my lung to fill with air. There we go. We got some air in here. Why? Because I moved my diaphragm muscle down slightly, which allowed my lung to fill up with air. But that was not enough air for singing. That's enough air for talking, maybe, or having a conversation, just everyday life. When we sing, we need to keep more air in our lungs because we have to retain our air for a longer period of time. So, my diaphragm, well, you tell me what my diaphragm's gonna do. My diaphragm moved down a lot, significantly, and it allowed more air to get into my lungs, and now I have enough air for singing. So your diaphragm is very important. It has to be active during singing. Now, of course, it's really hard to tell if your diaphragm is moving per se, which is why we focus on our belly when we sing, because it's a good indicator if our diaphragm is descending downwards or not. Because what happens, of course, is if our diaphragm moves down this way, it's going to push all the stuff in your belly out this way to make room for your diaphragm, all your organs and things like that. So when we breathe, we want our belly to be relaxed so that it can expand outwards like this. Let's try it. We're going to put our hands on our belly, and we're going to take what's called a belly breath. And if you feel your hands expanding out this way, that means that your diaphragm is descending. Let's try it. Inhale and exhale. Did you feel it? I did. And of course, on the exhale, your hands will return to their normal position. So, a diaphragm, super important for breathing for singing, but there's another component that's also important, and it's called your rib cage. Your rib cage protects your lungs and your other organs. And for this demonstration, it's going to be my hands. Of course, remember the other sciencey word that I taught you for the muscles in between each rib? They're called your intercostal muscles. So I've got my lung, I've got my rib cage now, and I'm going to try and inflate my lungs with air. That didn't work very well. I didn't get a lot of air in there. So now I'm going to try again, and my rib cage is going to allow my lungs to expand. What did my rib cage do? It expanded outwards like this, which made more room for my lungs to expand. So breathing is not just about the diaphragm and about your belly, but it's also about your rib cage. So now we're going to take what's called a rib breath. 2 hands on your ribs, and I want you to try and breathe so that your hands expand out like this. You should feel your rib cage coming out. Try it. And of course, on the exhale, your hands will return. Very good. It's almost like an accordion motion. Now, when we breathe for singing, we want to think about our ribs and our belly. We don't want to think about our chest and our shoulders. I see so many people breathe like this. There's nothing up here. Your lungs aren't up here. Your lungs expand this way. So we want to think about our lower body every time we sing. And of course, the best breathing for singing uses our ribs and our belly. So let's try that now. One hand on the ribs, one hand on the belly. Let's try and expand both, like a balloon. Ready? Inhale. And exhale. Very good. And that is how we breathe for singing.